This is called a high-low table, simply because it can help a patient go from standing in the high position to a low position in its basic use, but we use it oftentimes for pregnant women as they move through pregnancy. We can increase the space so there's room for their tummy to lie there when they're face down. We can use it successfully all the way up to full term. Once we get to full term, we add some more support and coverage to make it more comfortable for the mom and the baby, so that we can make our chiropractic assessment, sometimes our chiropractic adjustments on this table too. The moms usually always find that it's very comfortable to lay face down because they don't do that at all much during pregnancy, if at all.
So it takes the gravity off of her spine.
Off the spine, sure, so we can make an assessment, take some of the baby weight off the mom in a different way that she hasn't had in a while. Is that true? Does it feel good?
Yeah.
Some of the women say, can I just lay here for a while afterwards? We let them, but has those other purposes for us too.
And how many weeks are you, Elizabeth?
I am almost 39 weeks.
Oh my goodness. Okay, so yeah, definitely just about full term.
You can position this anywhere for comfort for you. Go ahead and do that.
And how does chiropractic help in pregnancy and preparation for birth, especially right now?
I'm going to go ahead and lower you down here. Yeah, great question. Well, chiropractic, in its fundamentals, how it began is a spine, nerve, whole body practice. So we work on the relationship of the spine first and how the spine affects spinal cord messages, spinal nerve messages to all the parts. So basically there's a twofold benefit to anybody, but particularly if you're thinking about the pregnant mom. One is structural, like how the structures move properly with one another when they go through these changes to bear weight of the baby on their body and the weight they need to gain for a healthy pregnancy. If all the structures are working more the way they're designed to work, they're going to be more comfortable through the pregnancy. And the mechanics, the structures of the pelvis, the sacrum, that carry a lot of the load in pregnancy and are very active in the labor process, are apt to work more efficiently the way they're designed to. Many of the times, men or women carry altered function of the mechanics in the body that they don't feel. Women, when pregnant, oftentimes will find that for the first time when they get back aches, neck aches, or more intense versions of that, like a sciatic nerve pressure that goes into the buttock or all the way down the legs, or pain stemming from the neck that goes into the shoulders or arms from the neck nerves. And those are by and large very resolvable in a chiropractic approach when the chiropractic office works on specific adjusting for correcting the nerve interference like we do. So that's during pregnancy. Many women report that their labors and births have been shorter and even more comfortable when they've utilized chiropractic care through a pregnancy than when they didn't. And that's a pretty neat advantage, but you can imagine with all the structures and nerves working closer to the way they're supposed to, that's got to be a good thing for the process. So while she's here, we'll go through some assessment steps that in chiropractic technique, there's always assessment before you make any adjustments to determine what the areas of the spine are that might not be moving right or might not be positioned right. Does this bother the back anywhere when I push?
Just a slight bit right here.
Okay.
No pain, just a little bit.
Right. And that's great, I might add, because we came from a place with you that this was severe and sometimes into the legs, is that right?
Yes.
To the point where it was difficult to walk and just get through normal daily activities, correct?
Yes.
And that was some time ago when she had less baby and body weight on her. And now the finding is, thankfully, and what great timing, when she's at nearing full term, she's more comfortable than she was halfway through this process. That should go that way for more women than it does. I think too few women know, and even their doctors don't know, that this kind of support is available for their pregnancy process. So we'll go through hands-on examination, palpation, detecting what muscle tone and beneath the muscles what vertebrae movement is doing and not doing. Of course, we have a history that we've been working on here, so I'm comparing what I know in our notes from our assessments before to now, and I can tell her that she has better functional signs than she did too. Not only is she feeling better, the way the parts are moving with one another and the lessened stress that we find in here is an improvement as well. So we're working on, in a moment, lumbar 5 and the L5 sacrum relationship. The sacrum, the base bone, very involved in pregnancy. one of the strongest front side anterior ligaments of the uterus plugs into the front side of the sacrum, which is internal to this spot. That's the theory of why chiropractic has helped a lot of breech babies turn without actually contacting the baby or the mom, just by working on sacrum positioning so that the ligament off sacrum to the uterus is not putting any tethering or tractioning pressure on the uterus. Thereby, the theory is it might misshape it or stress it in some manner that doesn't allow for the baby to have the room or comfort to rotate on their own. And there's a high success rate with specific sacrum checks that related to Dr. Webster's technique and the adjustments that go with that, resolving that, and then the babies are able to turn on their own. So that's a beautiful thing as well. Any mom who's going through my care in pregnancy, we're always doing the Webster check and adjusting anything related to that. That's just
Webster
part of the
technique.
process. Let's see.